So thank you for coming to this town hall. I thought I would take a little bit of your time this afternoon to acknowledge the appointment on my appointment as Vice President for Health Affairs and Dean of the school, which occurred recently. To tell you a little bit, for those of you who don't know me, I'll tell you a little bit about me. Talk a little bit about what happened over the last couple of years that led to my original interim appointment and then to my current appointment being named as Dean. And talk a little bit about my priorities and vision for the school. There are people in the room who know me since I was a medical student here. There are people in the room who were here when I was a medical student in 1977, when this was a new building. This was a new building. And then there are people here who obviously are new to the medical school and as well as to the university. So I arrived at GW in 1977 and graduated medical school in 1981. Took anatomy and biochemistry, and what were then all first year courses took place in this room. And then in the second year went over to room 101. Our microscopes, which students don't have to bring with them anymore. We had our own microscopes that we used up in 201. And that was our micro and histology lab. The anatomy lab is essentially the same. And much of this building has been updated, obviously, through the years, but the experience that our medical students are having today is not that different than the experience that I had as a student. I was really fortunate to have some really fabulous faculty and mentors that led me to go into psychiatry and was, in particular, had some terrific faculty at Children's National Medical Center who also became mentors. And so I came to GW for my psychiatry residency to do child psychiatry, which ultimately I didn't do, but it was really out of that experience doing pediatrics and working with some of the faculty at Children's in the psychiatry department, in the pediatrics department, in the child neurology department. And so at the time, and still today, the GW Department of Psychiatry, because of its close relationship and affiliation with Children's National Medical Center, really attracts applicants interested in child psychiatry. I did my residency here and was very fortunate to be recruited to stay on faculty. And so I stayed on faculty in 1984. I was chief resident in 85. I was joined the faculty and was involved in medical student education. Over the course of my tenure, directed all of the courses for the medical students, for the PA students at the time. Nurse practitioner students were in our classes also. I ran the clerkship, et cetera. So education was an important part of my identity as a junior faculty member. In 1983, the first case of HIV/AIDS was identified in Washington, D.C. The first case of AIDS in the US was in 1981, 83. And GW Hospital and many of the faculty at GW began seeing lots of people with HIV/AIDS. I was a psychiatry resident, started literally just going into people's rooms to talk to them to find out what was happening, because all of these young men were coming in and dying. At the time, we didn't know why. We didn't know what, we actually called it HTLV3. It wasn't HIV in those days. The route of transmission wasn't known. There was a lot of anxiety, a lot of fear. And I think pretty soon around that time, people started becoming aware that there was this young psychiatrist who was interested in HIV/AIDS, and I started getting a lot of referrals. At that time, a little later on, I applied for an NIMH grant in HIV/AIDS, got funded. And before I knew it, I was really going around the country lecturing on HIV neuropsychiatry, on issues around psychology and HIV, psychiatry. And much of my practice in those days was HIV, and particularly with an interest in HIV dementia, which we don't see a lot of, only its really subtle forms these days. But much of my practice in those days was people who were dementing, people who were dying. And so HIV/AIDS, death and dying, neuropsychiatry, GLBT issues all became part of my areas of interest. It was also around that time in the late 80s that Bob Keimowitz, who was the dean of admissions, who admitted me to medical school here, was then the dean of the school, and he got me involved in some committees, along with former late Winfield Scott, who was an associate dean. And so I was getting involved in committees. Dr. Scott actually got sick, retired, and I was sort of plucked out of my role as Director of Medical Education and Psychiatry to become an assistant dean. And I was particularly involved in educational policies. I did a lot of counseling of students. It was actually kind of nice to have a psychiatrist in the dean's office, which we now have again. It was a very formative time for me in terms of understanding how the medical school, academic medicine worked, and really getting, I think, a real respect for the culture of the school, the culture for our students and our faculty, and the importance of the relationships of our affiliates. In those days, the hospital was owned by GW. GW Hospital was owned by the university, and the MFA was also was part of the university. Over time, that changed, as we know. And in the late 90s, the university sold off the hospital to UHS, and then in 2000 spun off the MFA into a separate nonprofit entity. I'm saying that because that's relevant to what is happening in terms of my position now. So in 2000, I became the chair of the psychiatry department. And I think it was also a very transformative period for me because it was really a time when I could run something, an operation, a clinical operation, research, education and training. And it took over the department, and quite frankly, it was in really bad shape. It was losing a lot of money, And we really had to think strategically about how we were going to turn that around, which we ultimately did, and the department became profitable. We had to shrink before we could grow, but we did that, and we grew, and we really started recruiting some superb faculty. Our residency program really had been strong, but really began to take off as we began to integrate issues around health policy, global health, global mental health, and a real strong basis in community psychiatry. So our residency program really became extremely attractive, and we were, I think, in many ways recruiting the top medical students in the country. Fast forward to 2010, 2 years ago. The university had brought in a consultant to look at the medical center. It was clear that the entities now, the separate entities, the MFA, the hospital, and the school, that there were real problems in terms of collaboration, communication, et cetera. The consulting group came in and made a sweeping series of recommendations. Number one, they recommended that the medical center as we knew it, which was a sort of a level of administration that oversaw, that had originally in the 90s had overseen the hospital, the MFA, the School of Public Health, and also that GW Health Plan. There was also an HMO. That level of administration was no longer necessary in the new structure of the medical center. The MFA was a separate enterprise. The hospital was a separate enterprise, although the university does own have a 20% stake in the hospital. So the consultants came in and said, do away with that level of organization, of administration. Merge the position of Vice President for Health Affairs, who was the leader of the medical center, and merge that with the dean position of the school. And take the schools of public health and school of nursing and take them out from the medical center administration and have them report to the provost. So 1, make the medical center level administration disappear. 2, combine the VPHA and dean position. 3, what we call the 3-dean model, and that is have each dean of the schools report up to the provost. So that was the task in 2010, as well as a number of other things. In 2010, when President Knapp and Provost Lerman asked me if I would take on this position. I think the crucial, I think one of the reasons I was a likely candidate, number one, is I had now worked as an assistant dean on the school side. I'd been in the MFA, I'd been a chair, I had worked with, as a student, an alum, I understood the organization well, the culture, care about this organization. I've been here, other than the one blemish in my sort of past, which is having gone to Duke for undergrad, my career has been all at GW. Okay, so, you know, so obviously the leadership knew that I really, and knows that I really care about this school, this university. And really with over a 30-year history here, I think that's pretty clear. So the other really critical piece was around communication between the entities, is re-engaging and being able to ultimately work collaboratively with the leadership of the MFA, with the leadership of the university, and with the leadership of the hospital. Because it's very clear, the consultants say it, and I believe it in my bones, when we're all working at our best together, it elevates the school, our trajectory to the next level is dependent on our relationships and our working collaboratively and strategically with our partners. We're, you know, and that includes the children's, the MFA, and the hospital. So having had, good working relationships with the leadership of, all of the entities, I, accepted the position. And it's been, the 2 years, an enormous amount has happened. Obviously, this 2 years is, well, let me back up on that. So the 2 years ended recently, the 2 years of interimship. We got rid of the medical center administrative level. We took many of the functions at the administrative level, for example, like development, the operations of Ross Hall, Himmelfarb Library, finance, communications, and brought them into the school. We brought them, all of those into the school. We were able to cut a significant amount of overhead that was associated with the administration of the medical center that really wasn't necessary in the school. For example, we didn't need a government relations capacity in the school. The university has a very good government relations capacity, but under the old medical center organization, it was felt that that was necessary. So we were able to find efficiencies in that. We also developed some important memorandum of understanding with our partner, the Medical Faculty Associates, around research, around fundraising, and around the selection and appointment of the chairs in the clinical departments. Again, those were unable to we were unable to do that for 10 years in the first 10 years of the MFA having spun off, but it's really essential that we get those done for a couple of reasons. Number one, the Board of Trustees, the university, the leadership of the entire enterprise has made it clear that we need to grow research. And so part of the Memorandum of Understanding was around how do we incentivize research in the clinical departments? How can we work together to grow translational research, to have basic science faculty in our clinical departments, to have our basic science faculty on the school side working collaboratively with the faculty on the clinical sides. So there were really important reasons to create these new memoranda. And then in addition, we were we had been an academic medical center that really didn't have a grateful patient fundraising program. And so the only way that really could take place was to work together with the MFA and the hospital to make that happen and to have those agreements. So those agreements were forged in the first year. We also had some agreements with the School of Public Health and School of Nursing around use of this building and Himmelfarb Library, et cetera. And then we also began filling in new leadership positions as positions began to change. And over the last year or two, there have been appointments in health sciences and basic sciences, clinical departments, administration. I appointed Joe Bacchino, the Senior Associate Dean of Health Sciences. We had three recruits in the clinical departments, Dr. Tony Sadawi of surgery, Dr. Henry Kaminsky in neurology, and now Dr. Allison Ehrlich in dermatology. We've all been appointed chairs. The basic sciences appointed Michael Krinsky, the interim chair, after our former chair, Peter Hotez, left to go to Baylor. And then in the administration, appointed Ann Banner, the head of communications, Dennis Narango, the head of development in the school, and then Evan Polanski, the head of faculty at the Office of Faculty Affairs. So there've been, one of the questions that has come up is, what can you do as interim and what can you not? Well, the thing you learn as an interim is that the world doesn't stop. You have to act. Things happen all the time, and you've got a responsibility to all of the constituents that make up the School of Medicine, Health Sciences, and the university. So you are recruiting and appointing folks at every level of the operation, but there are some positions that are a little bit more potentially challenging in terms of recruit because of a commitment that people expect in terms of a decanal level, in terms of the dean level. So we're now looking at moving forward on the interim appointments that exist. That is clearly one of the opportunities now as no longer being interim, is I can move forward on the interim and look at each interim position and develop a strategy working with the other deans and chairs and faculty to move forward on those. And then continue the reorganization of the school, which is essentially complete, the school leadership, but there are a few things that I still want to do. One is to recruit a senior associate dean for research. Second is to have a senior associate dean for the MD programs, to bring the MD programs under one person rather than, I think, the 7 or so reports to me that have to do with admissions, student affairs, et cetera. We're looking to combine the finance and operations component in the school. I think, again, that will provide some additional efficiencies for the school. We're still recruiting for that position. And then I'll talk a little bit more about what up here is called the Chief Diversity Officer. So what are some of my priorities? This is not going to be a complete list throughout the talk, I can assure you, and that's why I'm open for questions, because I would be here forever, and you would too. So first priority when it comes to education and training has to do with scholarships. It is the first thing that comes out of my mouth when I talk to alumni, when I talk to potential donors. We have an obligation and a need to continue to raise money to support our students. And in that context, the goal is not only to recruit the best and the brightest as we do, but to provide more opportunities for our students and not to have that heavy debt load, or to lessen the debt load over time. Now, what we've been able to do, in addition to some really creative new opportunities for scholarships, for example, our Adopt a Doc program, where our alumni can support the tuition of a student in our school and create a relationship between the alum and the student. We've begun really holding the line on tuition. And that's not to say that tuition hasn't gone up, but the rate of increase in the tuition for the MD program we've really bent that curve so that where we were historically viewed as if not the most expensive, the second most expensive, and not that long ago, the fourth most expensive. Last year we were moved down to 8th, and now we're 13th. And the next year I anticipate, again, it's hard to know because you don't really know what every other school is going to do in terms of tuition, but we should be in the 15 to 18 range in terms of most expensive. It's still not enough in terms of the overall debt load that some of our students carry, but there's a real effort to, as I said, bend that curve and make a difference. So the fact that we're really now out of the top 10, I think in some ways it'll take a little while for people to recognize, it's our reputation as an expensive medical school, but we're moving down the list, and is absolutely one of my top priorities around affordability. Ensuring accreditation across the entire school, all of our programs have some level of national accreditation, and we work very hard and are working very hard on that in terms of all of our programs in the health sciences, and the med school, and the residency programs. Continuing to develop opportunities for our students locally and globally is an important priority. I'll talk a little bit more about that. As you know, we have embarked on a curriculum revision for the MD program. We've got a committee that includes students and faculty. It's now met 30 to 40 times. It's come up with a draft proposal that will now begin to be presented to our students and our faculty for their input. We have a little bit more work that they want to do on this, but the goal is to roll it out to every department, to our faculty, to our students, and get your input on this curriculum. Our ultimate goal is to be innovative, is to look at this sort of historical structure of the first 2 years of basic science and the second 2 years of clinical medicine, and move that around, integrate basic science a little later on, move clinical experiences further up, and reduce the amount of time in the lecture hall, increase independent learning. So I think there's a lot that's really positive about the current proposal, the current draft, and the next step after they sort of put a little bit more meat on the bones is to roll it out and get feedback and input and continue the revision. Our health sciences programs really have, I think, a very robust growth strategy, both in terms of distance education and the potential to utilize the GW's Virginia campus in Ashburn, and the potential to develop new degree programs, potentially in collaboration with the School of Nursing, with Columbian College. So I think there's a lot of opportunities with our health sciences programs. And in our residency program, graduate medical education, we have new accreditation policies coming down the pike that will be integrated over the next year. And we're looking at building a dermatology residency that doesn't exist now, allergy fellowship, and looking at, we've been bringing in international residents and fellows, and looking at other opportunities to, potentially expand our offerings in terms of residencies and fellowships. Clearly, one of the top priorities of the university is to make GW one of the top-tier research universities in the country. And we have been working very hard on this. The first step is working collaboratively with our partners on strategy to do that. And one part of that was the Memo of Understanding. But also, we have some really important partners at Children's National Medical Center where we've been collaborating with the children's faculty for quite a while. And now there are particular opportunities that flow through what's called a CTSI, which is an NIH-funded operation that deals with clinical and translational research that we're very much involved in. There's new opportunities with collaborating with Children's on their Healthy Mind and Brain Institute, which is a neuroscience-related opportunity. We are clearly looking to expand translational research and interdisciplinary collaboration within the school between our basic science and our clinical faculty with our health science faculty. There's, I think, an important part in research and in academia just across the country is breaking down the silos of departments, breaking down the silos of schools, and having collaboration. And so that's an important goal, and we're really trying to incentivize that with seed money that really does support interdisciplinary collaboration and also inter-school collaboration with the School of Engineering, with Public Health, with Columbian College, and that also has been moving in a very positive direction. There's certain areas that we're really looking to invest in and are investing in now. This is not exhaustive by any stretch, but MITM is microbiology, immunology, and tropical medicine. We are almost finished in recruiting a chair there. But we've been investing, as you know, in the construction in this building on the 5th and 6th floor are primarily labs for the microbiology department and the Center for Neglected Tropical Diseases. We're also looking to bolster our efforts in HIV/AIDS, not only because we are in a city with one of the, with not the highest infection rate in the country, but because we have particular strengths in this area within the MFA and within the School of Public Health. And there are real opportunities for us in investing in this area. So this is also an important priority. Neuroscience is really strong for us, and we're looking to increase that primarily through our relationships with children and in our recruit of Dr. Henry Kaminsky, who's the relatively new chair of neurology. Cancer is a major initiative for the university and for the school and our partners. And there, I think our vision and our goal is nothing less of our being an NCI designated cancer institute, cancer center, which would require some real effort over time in terms of recruitments and space, but that's the vision. And so we are looking to grow the basic science, the clinical efforts, and then areas related to population research, epidemiology. And cancer is really, really obviously important for a number of reasons, but two really important. One is the morbidity and mortality in terms of health disparities in cancer in the District of Columbia are some of the worst in the country, if not the world. The death rates related to some cancers in the district. So number one, it very much fits into our place in this community. And number two, we're an aging population. So we have certain expectations about cancer rates, et cetera. So cancer is an important priority. We're also looking, given that our space is relatively limited in Ross Hall in terms of lab space, looking to grow non-wet lab research, health services delivery, comparative effectiveness. And in that end, one of the really exciting initiatives that is evolving is what's called the Rana Institute, named after Dorothy Rodham, the deceased mother of Hillary Clinton. The Rana Institute, being run by Dr. Obayumi, is particularly focused on primary care, education, training, primary care in the District of Columbia, underserved populations, health disparities, with the potential to really look at the gaps in the city's healthcare delivery, and not only have an impact on closing those gaps and looking at health services delivery, changes to health services delivery, but hopefully creating as a program that attracts students, residents, and physicians ultimately to stay in the city, to work with underserved populations, to be focused on health disparities. And this is, I think, really very exciting for us as a school, but I think particularly for the District of Columbia in terms of a vision that we currently have. And then we're looking to develop an Office of Research Initiatives and Innovation to support the activities of our faculty in a number of areas, in particular those who are looking at product development and mobile health other non-wet lab related areas. And we're in the process of putting together an advisory board. One of my key priorities is diversity. And we've really actually done pretty well in this area. It's not a priority because it's not and something that hasn't been looked at and dealt with, I think, very well in the history of this school. But we are, the university has made a major initiative around diversity, and I feel like we can take it to the next level. So I had tasked a work group or a task force on diversity and inclusion, recently got their report, which we're looking over, and I'm going to meet back with the committee. But the first thing, looking to build capacity within the school to support efforts in diversity across faculty, students, and staff. Creating more pipeline opportunities into our academic and educational programs. And also, I think we really have an opportunity to tie in research and curricula in health disparities, health equity, and integrate that and ensure that we really have that, in my mind, what I would consider the best in the country. I really see this as an area we can be nationally recognized. And that's really the goal, is to create an environment that we are really making every single effort in terms of academically, employment-wise, around diversity and inclusion. I think we have great opportunities here. Programmatic growth. Our international medicine programs continue to really grow and expand and are doing extremely well, both in terms of developing relationships around the world, but also helping international or hospitals, medical schools, physicians outside the United States develop capacity, potentially by coming to GW for additional training and additional education. So we are working to grow those relationships. We're working to bring more international docs, students here. We're certainly looking to expand opportunities for students, residents, and faculty, both in terms of everything from medical missions to really being on the ground in developing capacity in medical schools and exchange programs. We're particularly strong in certain areas of the world like the Middle East, some in Africa. We're really looking to China, which is an important area for the university right now. And that's, I think, important for us, not only because of the university's interest in it, but because of our own and some of our faculty's interest in growing these relationships. It's also, I think, a good opportunity for us in terms of philanthropy. And right now, our international medicine program, they're getting ready to tee up a strategic planning process that our internal folks will hear more about. Clearly, to fund these ideas, to make these ideas a reality, we have to raise money. And we are investing in our development operation. We're investing in communications. We've linked them better so that our communications and development people are really working collaboratively, both in terms of communicating to our constituency in Foggy Bottom as well as across the country and the world, really reaching out to our alumni. We are working with our university partners and consultants about how we can effectively make our case to potential donors and our alumni. And I think we've been really successful in doing that thus far, but we're really looking to hone those messages. We've been developing and have developed a grateful patient fundraising capacity where we actually are screening our patients. And that is something that we are going to continue to develop and grow. Again, we talked about scholarships being really a top priority, but also endowed professorships. There are a number of priorities in fundraising. And as we listed all of those research goals, they require fundraising and supporting academic and clinical programs. We've got a really amazing alumni, almost 10,000 or about 10,000 alumni from the school, from all of our programs. And we are really looking to engage them and reach out to them and hopefully get them to provide additional support to us. Number of priorities as it relates to bricks and mortar. The labs on the 5th and 6th floor are almost complete. They'll be finished by the end of the year or the beginning of 2014. Our class center, which is our learning and simulation skills facility, is moving out of the 6th floor of the hospital into the 4th floor of Ross Hall, and that will be completed in 2014. That'll be a brand new state-of-the-art facility that our students across the school and residents and even faculty will be able to use. And then we're continuing to upgrade the utilities and the power plant. That should be completed in mid-2014. And as you know, the power plant that we're putting into this building will also power the Science and Engineering Hall. So there is a very, very complicated construction project, much more complicated than the labs on the 5th and 6th floor, that is taking place and will take place underneath Ross Hall to put the lines necessary to bring the power from Ross Hall into the Science and Engineering Hall. Beyond Ross Hall, we really are very limited in our space, and we clearly need more space. We need more labs. We need more teaching space. We need, we're just busting out of Ross Hall. The hospital, we will be moving out of the hospital in March of next year, and that means a lot of our conference room, our clinical skills learning, clinical learning and skills center, classrooms, et cetera, they're all being moved out as the hospital builds ICU and other patient beds. So we're looking to find spaces. We're looking at, there are 2 floors in the Science and Engineering Hall that have not been built out, that we are hoping that we can put our cancer efforts as well as our neuroscience efforts into those floors and really, again, expand our research space. We clearly will need a new building at some point to bring together our now becoming somewhat disparate offices in that we're leasing in different buildings. So part of the goal is to have another building or expand Ross Hall as best we can. And then also looking at the Virginia campus. We, as a school, will be embarking on a strategic plan. The university is completing theirs. I don't know if it's 100% finished, but it's essentially complete. Our strategic plan will certainly build on the university's strategic plan, but we will wait until we get all of our leadership positions in place before we actually move forward. We have started some preliminary work in strategic plans as it relates to health sciences and will in terms of international medicine and diversity and inclusion. And we are also working to develop strategic alignment with the hospital leadership and the MFA. So there are different strategic efforts going on before we really embark on an overall strategic planning process. So let me just say in conclusion, before I open things up for questions, there's no question that we're on an upward trajectory. We clearly have aspirations towards a new level of greatness, and I think there's absolutely, it's being built on the vision, the bold vision of the leadership of the university, of our board of trustees. I think if you listen to the chairman of our board of trustees, Russ Ramsey, you hear that excitement and that enthusiasm and that sense of that aspirational vision that I think President Knapp is leading so ably. So number one is this, it really comes from the top in terms of that vision. Number two, it's really built on our historic missions of healing and education, discovery, service, and was clearly our rich tradition of clinical education. Number three, this spirit of collaboration that now exists between our partners and this real sense that greatness is really dependent on how well we work together. And then finally, without question, it's inspired by our outstanding students and residents and faculty and staff and alumni who every day bring their deep commitment, dedication, and sense of purpose to make a real difference in the lives of people. And so I put at the bottom, GW School of Medicine, Health Sciences, Changing Lives, because when I think about what we do, I think we change lives as an institution for our students. When our students come in and they evolve over time, they grow, they become professionals, et cetera. There's a real change that takes place in their identity and in their sense of capacity and their, so changing lives of our students, changing lives of our faculty. Our faculty's efforts in research and how discovery has the impact and has the potential to change lives, whether it's our cancer researchers who are trying to make a difference in terms of cures for breast cancer, or in HIV research. And then ultimately, what we do every single day as clinicians and healers in impacting and changing lives. So it doesn't totally maybe act as a full umbrella, but in my mind, it's about what we do on a day-to-day basis to the lives of those people who are students, residents, faculty, to what we do for our community, and I think what we can do globally in terms of the impact that we can have as teachers, as researchers. So with that having said, I am open for questions, and yeah. Okay, all right, sorry about that, I apologize. Okay, all right, thank you. Well, let me just take a couple of questions, and I'm happy to take a couple of questions if anybody. The question is really about upcoming healthcare legislation. I think we really are challenged by not knowing exactly what is coming down the pike. I think that as an organization, we really do have to be somewhat nimble and flexible as it relates to the potential cuts that might be coming or not. But there's no question that emphasis on primary care education and training, we have such a shortage already with healthcare professionals across the whole spectrum of healthcare, but certainly in terms of the primary care needs. The Rana Institute is a potential response to that, but again, we're talking about relatively small, part of the world when you're really talking about the District of Columbia. But clearly offering opportunities, especially around interprofessional education and training, and looking for opportunities to support our efforts as it relates to primary care in terms of federal funding, foundations, et cetera. Okay, well, thank you very much. I really appreciate it. Feel free to contact me. Thank you.